back with part 3 of our Master the Moves mini-series. And as always, our goal is to help you complete the OASIS more efficiently. And being that I'm optimistic about just that, let's move right into M1810 upper body dressing. Okay guys, so this video is going to be a bit more condensed, and as opposed to me laying out the conventions in such great detail at the end, I'm going to post a link below with additional information for good measure. But I want you all to let me know if you like this format better, or if you prefer me to kind of more so slow walk you through like I did in the other videos. But let's go ahead and jump right into it. So with M1810, we're assessing our patient's ability to safely dress the upper body. And that entails us gauging our patient's ability to safely reach where it is they normally store their clothing. That's number one. For number two, we want to see if they're able to safely get their clothing in and out of their typical storage place. For number three, we also want to assess if and how well they're able to manage their zippers, their buttons, and snaps on their clothing as needed. And lastly, if our patient has a prosthetic, an orthotic, an arm sling, or some other supportive device that they're wearing, we also want to account for those as well. Now that's what to assess. But in terms of how to assess, CMS tells us that it's best to observe and to interview our patients in order to select the best response. And so we may just want to ask our patients or caregivers, what shirts are typically worn? Is it pullovers or shirts that have buttons on them? You may also want to ask if they have a supportive device that they're wearing, and if so, if they can demonstrate how to put it on or take it off. And we may just want to flat out ask our patients or our caregivers, what is it that's giving you the hardest time with dressing your upper body safely? So those simple questions quantifies my majority rule. It identifies what I more so want to base my answers on, and it also pretty much just helps me paint a really good picture for my comprehensive assessment. So again, those are just a few examples that you may want to add on to what you already like to ask your patients. However, in addition to asking those questions, I also want you to observe their appearance and their clothing to see if their responses are aligning with what it is that you're assessing. So CMS also recommends having our patient participate in the assessment process by having them open and remove their upper garments, if at all possible, as we go to listen to their heart and their lungs. Or you can just have them demonstrate how they typically dress their upper body. But either way, this gives us an opportune time to assess the range of motion of their upper extremities, their coordination, and their manual dexterity. So pretty simple, yet effective. Now, when it comes to translating my findings to the OASIS, I like to envision my mood as a color-coded scale that moves downward from independent to dependent. So basically, if my patient doesn't fall within that green or red area, then I know that I'm pretty much going to fall within that yellow zone. And that pretty much tells me that they need some type of assistance. And that makes it a bit easier for me because now I can just focus on 2 options as opposed to 4. And so at this point, I know I'm either going to select 1 if my patient is able to safely dress the upper body once the items are laid out or handed to them, but are unable to safely get to and from where it is they usually keep their clothing. But I'm going to go with response 2 if my patient requires assistance with actually getting dressed, even if that means just needing a spotter, verbal cues, or even reminders to safely dress their upper body. And this pretty much tells me that the definitive difference between response 1 and 2 is the nature of accessibility versus actual task performance. Response 1 is for our patients that need help with safely getting to their closets, their dressers, or wherever it is that they may typically store their clothing. Whereas response 2 is for our patients that need help with actually getting dressed or dressing their upper body. So guys, that's pretty much the meat and potatoes. I just want you to also remember a few things before I get out of here, which is to always grade your patient's ability based upon what it is they can do safely. I want you to view them through a holistic lens, and I want us to identify what it is that's impairing their ability to safely dress their upper body so that we can put forth our best efforts to resolve whatever it is that may be. Now, in instances where your patient's ability may vary over time, I suggest more so relying on your assessment skills and your deductive reasoning to determine what it is they can do more than 50% of the time, because these questions are so intricate, and I want you to trust yourself to choose the best response based upon what you see and how you know you are to answer these questions as opposed to what you're told upon assessing your patient. I also want you to keep in mind that you're basing your answer on what it is your patient wears most often. So if it's just pullovers and undergarments and that they never wear button-up shirts, then your answer should more so reflect on how your patient is able to safely navigate those two articles of clothing in particular. And lastly, remember that it is permissible to collaborate with your agency staff members if they've had direct contact with their patient and if your team collaborates within that OASIS timeframe window. Now again, guys, I'm trying to make these videos a bit shorter so you won't be overwhelmed or just flat out bored, so I'll stop here. But if you have any questions or concerns, just know that I'm a DM or a comment away. And don't forget about the link below for additional information. More importantly, guys, I would love it even more if you'd be willing to share some of your own tips, tricks, or experiences as it relates to M1810. But that's it, guys. That's all I have. Let me know what you thought about this tutorial, and if you found it to be helpful, please like, share, and subscribe. Also, we would love for you to join our Facebook group if you have not done so already, because we have so much great content there as well. And of course, thank you so much for tuning in, and even more so for all that you do as home care nurses each and every day. So in the meantime, guys, take care of yourself, be safe, and we cannot wait to see you back again soon.